Air Purifying Respirator Awareness. In this session, you'll have an understanding of air purifying respirators and how to use the 3M half mask respirator. There will be a knowledge check or quiz, and you must achieve 80% pass mark on that quiz. Understanding air purifying respirators, what you need to know before you begin using your air purifying respirator. In many workplaces, the air you breathe can be hazardous. Potentially harmful dust, mist, fumes, gases, and vapors may exist. Breathing airborne contaminants can damage your lungs or cause other sickness or disease, and even death. If engineering controls or other measures are not sufficient, you can help reduce your exposure to certain airborne contaminants by wearing a respirator. The standard respiratory protection is that it must be used as per manufacturer's instructions, not to be modified in any way. You must be clean-shaven to use. Facial jewelry that could impede the seal must also be removed. Hair must be pulled back from the forehead and away from the seal. So you might be asking yourself why clean-shaven is important. That's because glass fiber, asbestos fiber, and fume particles are a lot smaller than human hair. Human hair or stubble can create a gap in the seal, allowing contaminants in. Air purifying respirator training must be done every 2 years, and fit test must be done every 2 years, and must be completed before you can wear your air purifying respirator. The main difference between a quantitative mask fit testing and a qualitative mask fit testing is that quantitative testing uses a machine to objectively measure the amount of leakage or quantity, while qualitative testing relies subjectively on the user's sense of taste, smell, or irritation in order to detect leakage. Determining the correct protection. The type of respirator you're going to use will depend on a range of factors, such as the hazard, the concentration of the hazard, such as an example, an air purifying respirator will not protect from high levels of H2S, the amount of exposure you will receive. Is the environment immediately dangerous to life and health? Is the oxygen deficient 19.5% or lower? For this session, our focus will be on the half-mask respirator. Some of the advantages is that it's lightweight and good protection for many contaminants. There are some limitations, however. It's limited by the type and capacity of the filters or cartridges used. Proper fit is essential and cannot be used in oxygen-deficient atmospheres or atmospheres where there are immediate dangers to life or health, or where breathing may become difficult because of additional effort required to draw air through the purifying media. The application for these half-mask respirators are used for protection of a wide variety of respiratory hazards. Your air purifying respirator, or APR, is only as good as the cartridge or filter. And there are different types of cartridge or filters, such as a particulate filter, or gas and vapor, or combination. Make note of this chart and notice the type, filter, and efficiencies of each. This chart will be at the tool crib, and check your permit for what is required. Know the life of your cartridge, and note that breakthrough is not a means to gauge cartridge life. Cartridge life can be affected by temperature, humidity, multiple contaminants, and exertion levels. Be alert. Know when to leave an area. You must leave an area immediately if you smell or taste contaminants or sense irritation, or experiencing dizziness or distress, or if your breathing becomes difficult. Ensure that you ask your supervisor, consult your permit, and request an air sample when needed. A quick summary of this section. You should now be able to describe the benefits and limitations of air purifying respirators, and be able to differentiate between air purifying respirator cartridges and filters, as well as describe the difference between a qualitative and quantitative fit test. In this section, we're going to look at using the half-mask air purifying respirator, the 3M 6000 series. We want you to take a moment to familiarize yourself with the 3M 6000 series half-mask main components. There's the head harness assembly, the inhalation valve, the facepiece, inhalation port gasket, and the exhalation valve. Let's take a look at the following video from 3M on how to don, doff, and care for your 3M half mask APR.
Inspection. Before each use of your half facepiece respirator, inspect it for any signs of damage. Check the facepiece, gaskets, straps, and all plastic parts and valves for distortions, cracks, tears, and dirt. Your respirator will not function correctly, and your health could be jeopardized if your respirator has damaged or defective parts. If it does, replace them before using the respirator. Assembly. 3M half facepiece respirators are designed to be used with a variety of 3M bayonet attachment chemical cartridges and particulate filters. To attach the round 2000 series and 2200 series filters, align the opening on the filter with the facepiece attachment. Push them together and turn the filter clockwise 1/4 turn until it stops turning. Do not turn past the stopping point. Attach the second filter to the other side. When attaching rectangular 7000 series filters, simply align the line on the inside of the filter with the small bayonet lug on the facepiece. Push together and rotate clockwise 1/4 turn to stop. To attach the chemical cartridges, simply align the mark on the cartridge with the small bayonet lug on the facepiece and push together. Rotate the cartridge clockwise 1/4 turn to stop. Follow these instructions for the second cartridge. Donning 6000. Before you put on your respirator, make sure the straps are pulled far enough through the buckles to permit easy adjustment. Place the respirator over your mouth and nose. Then pull the head harness over the crown of your head. Position the facepiece low on the bridge of your nose for the best possible fit and to prevent the respirator from blocking your vision. Take the bottom straps in both hands and hook them together behind your neck. Tighten the straps by pulling on the ends, top straps first, then the bottom, until the respirator fits securely but comfortably. Do not pull the straps too tight. If the straps are too tight, push out on the back of the buckles to loosen them. Always check the seal of the respirator to your face before entering a contaminated area. Donning 6000 DD. Before you put on your respirator, adjust the head cradle size to comfortably fit your head. With the head cradle positioned on the crown of your head, hold the strap ends with one hand and slide the facepiece up onto your face with the other hand. Position the facepiece low on the bridge of your nose for the best possible fit and to prevent the respirator from blocking your vision. Take the bottom straps in both hands and hook them together behind your neck. Tighten the straps by pulling on the ends, top straps first, then the bottom, until the respirator fits securely but comfortably. Balance strap tension by adjusting at top and bottom strap buckles. If the straps are too tight, push out on the back of the buckles to loosen them. User seal check. Always check the seal of the respirator to your face before entering a contaminated area. Before you enter any contaminated area, you must perform either a positive or negative pressure user seal check. To perform a positive pressure user seal check, place the palm of your hand gently over the exhalation valve cover, being careful not to apply too much pressure and disturb the face seal. Exhale gently. If the facepiece bulges slightly and you feel no air leaking between your face and the face seal, your respirator has sealed properly to your face. To perform a negative pressure user seal check with cartridges, first cover the open area of the cartridge with the palms of your hands. Filter retainers may aid in conducting a negative pressure user seal check. To perform a negative pressure user seal check with the round 2000 or 2200 series particulate filters, position your thumbs over the center of the filters to restrict airflow through the filter. To perform a negative pressure user seal check with the rectangular 7000 series particulate filters, squeeze to compress the filter. After you've sealed the filter or cartridge inlet, inhale gently. If the facepiece collapses slightly and you feel no air leaking between your face and the face seal, your respirator has sealed properly to your face. If you detect air leakage when conducting either the positive or negative pressure user seal checks, reposition the respirator on your face or readjust the tension of the straps. Then repeat the user seal checks. If you have any difficulty getting the respirator to fit, review the user instructions in the packaging or the fitting instructions provided by 3M to be sure you're putting it on correctly. If your respirator still doesn't fit correctly, see your supervisor. A user seal check must be performed every time you put on your respirator. Never enter a contaminated area if your respirator does not seal properly. Remember, a user seal check is not a substitute for a fit test. It's very important that you have a fit test to be sure the respirator is capable of fitting you properly. Removal 6000. To remove the respirator, unhook the lower straps using both hands and pull the head harness over your head. Removal 6000 DD. To remove the respirator, unhook the lower straps using both hands. Then slide the facepiece down the straps to your chest. Understanding how to properly and safely use, maintain, and secure your respirator is of utmost importance. Don't forget that the user instructions are included with the respirator. And remember to always ask your supervisor if you have any questions regarding respiratory protection.
Here are the best practices for doffing a half-mask APR. Go to an uncontaminated area. Unhook the lower straps using both hands and pull the head harness over your head. Always replace air purifying elements after water spray decontamination. And inspect all components again for wear or damage. And remember to store in a clean, dry area. Just a reminder on the care of your APR. Clean with respiratory cleaning wipe. Store in a resealable storage bag or suitable container away from contaminated areas. Whirly APR are regularly sent for cleaning on site by a third-party vendor. Store in a natural shape. Keep from high heat. Damaged or worn? Then return it to the Whirly tool crib or coverall shack. Air Purifying Respirator Course Summary. Remember to select the right equipment for the job. Inspect your equipment before use. Don and doff your equipment and perform leak checks each and every time you don. Clean, inspect, and store your air purifying respirator after each use.